Welcome back to HealthWise. With us is Dr. Jason Hatfield, and we were talking before the break about the energy drinks and about how it correlates to high blood pressure and how we're seeing a problem with the youngsters nowadays coming with, they're just kind of abusing it, and there's no regulations on it. And I don't know if any adults are doing it, but I'm sure they are. But I mean, when I say adults, I mean elderly adults. I would, and I'm sure you would agree. I would say don't do it.
If I would always say don't use things we don't need to get through the day. But admittedly, that's more practice, what I'm preaching as opposed to necessarily conforming to it myself. Caffeine is a part of probably every one of our days, but try to limit your intake clearly. And if it's, it's never absolutely necessary. So if you can avoid it, that's a good idea.
Sure. Okay. Well, Doc, we'll kind of get off of high blood pressure a little bit because, I think we've hit every key point on it, I think, anyway, unless you have something else you want to talk about. Let's talk a little bit about the flu season. Everybody is worried about, I've seen the signs about the flu shots. Do y'all give the flu shots?
We do. We've been giving them at least since the beginning of October, if not some toward the end of September. We have seen cases of the flu already. In fact, my wife has seen some pediatric patients as early as September with the flu. We're giving them now. We definitely recommend it to everyone. The benefit far outweighs any risk that may be associated with the immunization. And to this point, our current injection carries very little risk. And that's one of the hardest things we as primary care physicians and physicians in general fight is dispelling some of those myths that come with the flu shot. Most common one being, I don't want to get the flu. And that may have been true 20 to 30 years ago. It is true of some vaccinations that will contain what we call a live virus.
Right.
You potentially can get a mild form of the disease. That's not the case with the flu. The flu virus, the flu vaccine is an inactivated virus, meaning it takes a small piece of the virus and we use it as a way to prime our immune system, to create an immunity. I liken it when I talk to patients to giving a hound dog something to pick up a scent. That's essentially what we're doing. And that way, when you're exposed to the flu, your immune system is primed, it's ready to fight it off. It either lessens the severity of the illness or prevents it entirely.
Right.
The second is that I've never had the flu, I don't need the shot. And that's unfortunately a problem because just because it's never happened before doesn't mean it's not going to. There's a reason we have insurance on our cars, our houses, all of these types of things. We're trying to prevent occurrence, and to base that on something that may not have happened in the past becomes a problem. The third is if we can vaccinate more and more people, we reduce the burden on the population in general, and that's what we're looking for. We want to make sure the flu shot is not just for me, it's not just for you, it's all those people that we come in contact with,
Right.
And that's what we're trying to reduce. Some years were better than others. Last year was very successful. Each year they attempt to try to guess the most common strains that are going to affect us. Some years they're better at guessing than others. Last year was very effective. Our screening regimens, or our vaccination period has increased, and we're catching more people that way and preventing more illness. So I think on the whole we've been successful, and hopefully we'll continue to stay that way. We just have to get the community involved, and that's where we come in. We've got to talk to people and educate them. So if you come see me, you're going to get the spiel regardless of age, sex, where you're from, how many times you've had the flu. We're going to talk about it every visit. I may not convince you, but if we can at least get the word out there, people will come around eventually.
Well, good. That's something, and I've always thought that that's a problem, that, there was always a fear, and rightly so. I even was susceptible to that a while back. I know better now, but I remember saying, oh man, I'm not going, I'm going to get sick. As soon as they give me the vaccination, I'm going to get sick.
Right.
Now, don't they still do, I think they use the live virus in the nasal?
They do. The flu mist or the nasal preparation is still the live virus, and that's why that particular form of vaccination is restricted to certain patient types. We'll use it in children in certain cases because it's easily administered and they don't like
Right.
injections. We try to avoid it in the extreme of ages, those with what we call immunosuppressive diseases, meaning their immune system may not be able to mount the appropriate response. Pregnant women, we don't expose them to the live virus. But more often than not, it's the injectable form.
Right. And now I've even seen on TV they have the little hedgehog, the little commercial with the little small they call it almost the painless
Right.
flu shot. So that's going to help y'all a lot as far as
needle
the kids.
Technology, for lack of a better term, has
Right.
improved dramatically. The injections aren't nearly as painful as they may have been even 5 years ago. But
Right.
you're right as far as the misconceptions. I myself, when I was young in medical school, I unless they forced me to, I didn't get the flu shot, and that's a poor attitude to have. But you feel like you're young and invincible, and you don't need it. You haven't had to worry about it before, so why bother? But again, it's to protect those around us as much as it is ourselves.
And I know I'm around sick people every day, and I mean, now, of course, I go as soon as they offer it. It's like,
Right.
okay, hey, here's my arm, give it to me. Because if not, like you said, I'm around, sick people every day, and I can catch it from them and spread it on to someone else. So I don't want to catch it and give it to someone that I'm patient that
Absolutely.
I'm responsible for. So, Doc, like I said, it was a pleasure having you on,
appreciate you.
and we learned a lot. Audience, go see Doc Hatfield on Union Street, and he's a good guy. Go check him out. Let him check your blood pressure and also immunize you for the flu. Doc, thanks again.
Thanks a lot. Appreciate you.
And we'll see you next week on HealthWise.
Honesty. Pass it on.